Hello everyone, welcome to Pharmacology Further podcast, and today we are having the e-newsletter of March 24. I know we are going a little delayed, but that's okay. We are going further and that is what is important. So without any delay, let's get on to the most important points. First of all, coming to the section, is pharmacology difficult? The March FDA approved drugs, they are denosumab DDBZ, and the brand name is Japontai. The injection was approved on March 5, 24 for the treatment of osteoporosis. Mechanism is as follows. It's a rank ligand inhibitor interchangeable biosimilar to denosumab. Coming over to the next drug in the list, we have tislelizumab JSGR, and the brand name is Tevimbra. It is an injection. It was approved on March 13, 24 for the treatment of esophageal carcinoma. The mechanism is as follows. It's a humanized immunoglobulin G4 anti-programmed cell death protein 1. It's a monoclonal antibody indicated for the treatment of adult patients with unresectable or metastatic squamous cell carcinoma. The next drug on the list is resmetirom, and the brand name is Rezdiffra. It was approved on March 14, 24 for the treatment of non-alcoholic steatohepatitis. It's a thyroid hormone receptor beta agonist and used always as an add-on drug. The next drug on our list is etidarsagene autotemcel, and the brand name is Lenmel-D. It's a suspension for IV infusion. It was approved on March 18, 24 for the treatment of metachromatic leukodystrophy in children. It is basically an autologous hematopoietic stem cell that is abbreviated as capital HSC gene therapy. The next drug on our list is aprocitentan, and the brand name is Trivio. These are the tablets. They were approved on March 19, 24 for the treatment of high blood pressure as a combination therapy. Mechanism is as follows. It's an endothelin receptor antagonist. The next drug on our list is Givinostat, and the brand name is Duvizat. It's an oral suspension. It was approved on March 21, 24 for the treatment of Duchenne muscular dystrophy. It's a histone deacetylase inhibitor. The next drug on our list is sotatercept, and the brand name is Winrevair. It is an injection. It was approved on March 26, 24 for the treatment of pulmonary arterial hypertension. It's an activin signaling inhibitor. The next drug on our list is Vedadustat, and the brand name is Vafseo. It was approved on March 27, 24 for the treatment of anemia due to chronic kidney disease patients who are already on dialysis for up to 3 months. The mechanism of the drug is as follows. It's a hypoxia-inducible factor prolyl hydroxylase, which is abbreviated as capital HIF-PH inhibitor. The next drug on our list is Denicopan, and the brand name is Voidea. These are tablets. They were approved on March 29, 24 for the treatment of extravascular hemolysis associated with paroxysmal nocturnal hemoglobinuria. And what else do you need to know about this last drug? It's a complement factor D inhibitor. Now coming over to the next subsection, the latest medical updates. What do we know about the latest researches going on? Well, it's something very interesting and very informative. Let's get started. The latest studies reveal that use of metformin as anti-diabetic drug could additionally prove helpful in treating certain breast and neurological cancers. Second point, in the dietary guidelines of 2024, ICMR has highlighted the palm oil as much better than other oils like groundnut oil, cottonseed oil, etc. Why? Because it has a balance of fatty acid profile and enriched nutritive substances. Next important point, current researchers have shown more cases of relapses in patients of multiple sclerosis who switched from the drug natalizumab to fingolimod therapy. The next important point, current clinical trial studies have shown improvement in Parkinson's disease, when lixisenatide, an anti-diabetic drug, was repurposed for this particular cause. The next point, recently generative artificial intelligence, that is capital AI, shows beneficial outcomes as far as mental health is concerned. It's of great use in helping research, training, and therapy. Human expertise added can reduce the inaccuracy and biases if they are involved. The next important point of information, randomized controlled trials, that is RCTs, conducted to use telemedicine-based therapy to treat subjects suffering from coronary artery syndrome. They have shown great clinical benefits. Next point of information, we have xenotransplantation with pig transplants and resulting short lifespan of the subjects. They have actually not proven a successful endeavor from the scientific point of view. And the last important point of information, what do I have for you all today? New non-hormonal drug manufactured by Bayer company named as alignzentant has proved to improve the quality of life in postmenopausal women. How does it do that? It suppresses the hot flushes. The sleep disturbances are also reduced. It could be a promising alternative to HRT, hormonal replacement therapy. That's all in the latest research and medical updates section. Now we'll go to the next subsection, from my classroom. In this particular section, I will be sharing some insights of pharmacology learnings from the classes that I have taken this month, or if I read something of importance in the particular subject. Well, my own reading topic comprised of acidity, acid reflux, hyperacidity, gastroesophageal reflux disease, that is GERD, and its treatment this time. Okay, let's get to know more details about it. Acidity describes the amount of acid in the body or substance. It is measured on a scale of pH scale. On this scale, the value of 7 is neutral, while decreasing value towards 0 gives an indication of increasing acidity. Excess of acid production in stomach leads to discomfort, indigestion, sourness in mouth, nausea, regurgitation, restlessness, burning in lower chest, pain in the chest and abdomen, etc. Excessive stress, oily foods, spices, obesity, lack of physical activities, smoking, tobacco habits, drinking of excess of alcohol, coffee, tea and carbonated drinks, they are all common causes of acidity. The acid reflux occurs via the food pipe and causes burning sensation in the chest. Once in a while it is not a big problem, but regular bouts of acid may indicate some danger, so one should definitely consult a doctor in such particular cases. Some helpful non-pharmacological aids at home could be sought with tulsi, mint, fennel seeds, turmeric, ginger, cloves, cumin seeds, buttermilk, watermelon juice, etc. What about the pharmacological treatments? Well, definitely I have a good list of drugs for you. Antacids, having calcium, magnesium and aluminium salts, though they are overused, can always harm the kidney. Next, H2 receptor blockers like famotidine, cimetidine, nizatidine, ranitidine. They are common drugs used to suppress the acid reflux. They show their effect in half hour to 90 minutes. And definitely in particular one day, the positive effect is seen. Famotidine shows ADR like headache, cimetidine shows ADR like diarrhea, headache, nausea, rashes and gynecomastia. What about other drugs? Proton pump inhibitors. They are omeprazole, esomeprazole, lansoprazole, rabeprazole, pantoprazole, dexlansoprazole. These are all available as tablets or capsules. So they are taken orally half an hour before the meals. These are the drug of choice for gastric esophageal reflux disease, that is abbreviated as capital GERD, peptic ulcer, Zollinger-Ellison syndrome, H. pylori infection, etc. What is the mechanism? The mechanism involves blocking of the hydrogen potassium ADPase pump, that is a proton pump, and that is how it suppresses the acid production. What can be the complication of acidity? Have you ever wondered? Well, definitely. There are stomach ulcers, cancer, pain in chest, abdomen, indigestion, etc. How can you diagnose? Well, diagnosis of acidity is by following tests: X-ray of esophagus and stomach, and also upper GIT endoscopy to see the mucus lining. So that was all in from my classroom section. Moving on to the important next big section, Radgin Wiz. So from the Radgin Wiz writing desk, what do I have for you all this time? Well, I would just like to confess that writing has come to a standstill for a while as the other chosen projects become very overwhelming, but it is not a writer's block, mind it. How do I know? Because my mind is always inclined and active towards writing my upcoming book, Bangalore and Bingo. Scenes, plots and dialogues are taking course in my mind. Hopefully it's gonna be another bash of pleasure and joy, as always my young adult books have promised to be. So that's all I have. News and updates from Radgin Wiz writing desk. Moving to the next important nutrition section, we have simple and sparkling. What topic do we discuss this time? Well, you should know turmeric is the golden spice. What should we know about it? The active ingredient in turmeric is curcumin. Turmeric contains compounds like curcuminoids with healing and medicinal properties. It's a great antioxidant and has a powerful anti-inflammatory properties. The best way to consume turmeric is to have it along with black pepper, which contains piperine. Why? Because it enhances the turmeric absorption many folds and increases the bioavailability of turmeric. Curcumin can boost brain-derived neurotrophic factor, that is capital BDNF. This helps in reversing the senile changes in brain and memory and help in diseases like depression and Alzheimer's disease. It protects against heart diseases and damage. It helps by improving endothelium function. Well, it can protect against cancer by causing death of the cancer cells, reduce angiogenesis, that is new blood vessel growth in tumors. It also reduces metastasis, that is cancer spread. It is very effective in reducing pain in arthritis and osteoarthritis. It should not be consumed too much by pregnant and nursing ladies. Why? It should not be used in diseases and the problems of gallbladder and kidney. How does turmeric help? It helps in fighting many viral infections including flu and herpes. It helps to relieve and alleviate premenstrual syndrome symptoms and pain. As far as the drug interactions are concerned, turmeric can lower down effects of indomethacin, aspirin, ibuprofen and acetaminophen. Turmeric should not be taken along with chemotherapy agents like camptothecin, doxorubicin and cyclophosphamide, etc. The blood thinning can be enhanced with turmeric if patients already they are taking warfarin. High amounts of curcumin can cause side effects with immunosuppressive drugs like tacrolimus. Turmeric is also ineffective for stomach ulcers. It can be safely applied topically and safely used as an enema, that is the rectal route. Turmeric increases side effects of talanolol and losartan. It acts synergistic to anti-diabetic drugs to lower down the blood sugar. That's all I have from the simple and sparkling section of nutrition. Let's move on to our next big section, off the cuff talks. Can you see a beautiful picture of mobile in the newsletter? What does it say? Well, let's get the time and it's right time to learn the mobile manners. The mobile manners. Master the mobile and don't let the mobile be your master. Practice good and strict controls. Mind your tone and volume. Always speak softly. Never let phone hinder your daily chores and routines. Turn the phone silent or off while doing some important other work. Use nice, amicable language and words. Never use harsh, wrong words or comments as phone calls can be recorded now. Don't talk about confronting, enraging, private and confidential topics in public. Don't make calls in library, theater, church or restaurant table. Text messages should not be used during a class or a meeting. Very personal messages should not be texted. Never use phone while driving. Well, that's all from my end. This lovely March issue is in front of you as a newsletter and now as a podcast. Hope it satisfies your quest for information and medical updates and the news. The next April issue is on its way. Spread the word and don't forget to subscribe. Hit the like button if you really liked my episode. Well, it's gonna be a great motivation to my efforts. Till the next time, thank you, take care, bye.